Hey, welcome. This is Efkan. I'm a psychologist and I live with borderline personality disorder. In this video, we're going to discuss what, how, and why DBT, so dialectical behavior therapy, is such an effect, a good effect on dealing with BPD. And the goal is to do all of that in the next 10 minutes. So let's get started. DBT is basically a skills-based therapy for dealing with intense emotions. So for us, emotions are usually very intense. They can fluctuate from here to there, and they can change suddenly into a different emotion that has nothing to do with the first one. So basically what DBT does is teach us skills we can use in the real world so we can manage those intense, frequent, and fast-changing emotions. So often our emotions, they're kind of like a storm that can pull us under. And DBT is, through skills, kind of gives us a life jacket. Not that we totally stop feeling pain or something, because people, without BPD also obviously feel emotional pain. But just so that we don't drown. DBT has basically two big messages. Its first message is acceptance. Second message is change. Now, this may seem contradictory, but not really. What we can do is we can think about it this way. Usually, we have to accept what's going on before we can know what to change. Without acceptance, it's hard to read reality. For example, we might underplay something or we might overplay it. But if we can really accept what's happening, we can see it more clearly for what it is. So acceptance brings a sort of wisdom to the equation. It helps us see what is really going on, how we actually feel, and what this situation actually means. And sometimes we realize we do not have to change anything because it is not as bad as our mind makes it. And sometimes we realize it's bad, but now we have clarity. But all of that is hard to do without acceptance. So you could say DBT combines two worlds. On one side, acceptance, more like a Zen approach from Eastern Buddhist tradition. On the other side, change, more like a Western action approach. And in DBT, they work together. Now, that being said, DBT also focuses heavily on safety and stability. First, it targets life-threatening behavior, so things like self-harm and suicidal urges. Second, it targets anything that makes therapy fall apart, because staying in treatment is part of what makes improvement possible. Let's say, for example, we have a bad week and then we want to cancel or ghost the therapist. DBT takes that seriously, much more than other therapies, because we cannot improve if we keep dropping out. Third, it targets problems that keep daily life chaotic, like substance use, impulsive behaviors, things like neglecting self-care, and everything I have discussed so far is done through the 4 skill areas, if you will. So the first one is mindfulness skills. That is like the foundation. So this is the acceptance side of the therapy. It teaches us to notice what is happening inside without immediately reacting. For example, let's say you feel that warm glow in your body and your mind goes, "They hate me." Mindfulness is noticing what's happening. And because we notice it, the emotion becomes less intense. We can't explain exactly why it works that way, but it does. And then we do not have to act on it because the emotion lost its strength. And then we have the distress tolerance skills. These are basically crisis skills. Think of it like an emergency brake. We do not use these to solve a problem. We use it to survive the moment without making it worse. For example, we just had a fight. Our urge is to text 10 messages or to block them, to break up the relationship, whether romantic or a friendship. Distress tolerance is the emergency move. This can be something like we put the phone in another room, we splash cold water on our face, or we hold ice in our hand. Those type of things. And there's a huge list of skills like this. Usually, there are a few that work really well for one person, and a lot of them don't. So the trick is to get your hands on a huge list of skills and then to keep trying them until you find the ones that really work well for you personally. So that brings us to the third skill area, which is emotion regulation skills. This is basically about understanding what we feel and making our emotional system less reactive. So think of our nervous system like a very sensitive car alarm, let's say. For many of us, it goes off fast and it goes off loud, even when the threat is not so big. So emotion regulation is learning in and out how that alarm works and slowly making it go off less easily. And lastly, interpersonal effectiveness skills. These are basically relationship skills. For example, how to ask for what we need, how to say no, how to keep self-respect, how to not be harsh. So we learn how to communicate in a way that is polite and constructive so we can get our needs met without damaging the relationship and also without ignoring the other person's needs. So for example, a friend keeps calling late at night when we are exhausted. Instead of picking up every time and like resenting them, we can just say, I care about you, but I cannot do calls after 10. If it's urgent, you can still call me. Otherwise, let's talk tomorrow. Now, what does DBT look like in real life? A typical week in therapy often includes one individual therapy session, one skills group, usually 2 to 2.5 hours, and phone coaching for real life moments when we need help because we're in a crisis or close to one. Also, DBT is for therapists very team-based. Therapists meet in a consultation team pretty often because working with BPD can be very demanding, and they also need support to stay healthy and effective. If you have become more interested in DBT, I already have 2 long videos about DBT you can check out. They are basically definitive guides, each about an hour. Next time, we're going to talk about schema therapy, and that is one of the 3 most recommended therapy forms for BPD, next to dialectical behavioral therapy and mentalizing-based treatment. Well, thank you for watching. See you next time.